MDS patients are older patients. Median age is above 70. And to date, unfortunately, there is no really good treatment to definitively cure this patient, because the intense treatment that we can provide to the patient is not really used and cannot be used in older patients. And new drugs are unfortunately not as good as we could expect in order to cure this patient. So for this reason, allogeneic transplantation in older patients with MDS become a very important question. The question is, what patient can be really reasonably transplanted? First one is the high-risk patient. For this patient, the outcome is so poor that clearly we could there is a recommendation to treat this patient. For intermediate risk, or for what we call low risk, including the intermediate cytogenetic risk, there is still a lot of debate. Not because we will cure the patient in the other way, but because the duration of their survival is not neglectable. So people have to decide to go frontline to this kind of treatment. This is an important debate, and it is not solved at the present time, but because of the different possibilities we have developed over years, is more and more something we do. On the top of that, one of the limitations of transplantation in older patients is the possibility to find a donor. For years, we have transplanted patients from an HLA matched sibling. In fact, over the 15 last years, we have shown that clearly an haplotransplant, so mismatched transplant from the same family, will give the same result, including the patient with MDS. So we have no more limitation with the donor. We have no more limitation with the intensity of the treatment, because we can really use reduced intensity conditioning regimen. So now what has to be a debate and what has to be discussed between the doctors taking care of the patient with MDS and the one doing the transplantation is what is the best time to do the transplantation. And still, it is not yet solved.